Hey guys, Tiffany Wise, and I'm going to talk about LASIK eye surgery. My visual aids, I have a brochure from my eye doctor. Just kind of gives you the what to know about LASIK. And then this is more or less a comparison of how much people spend on contact lenses versus LASIK. So 2020. Some people think, oh, 2020, year 2020, this year, this crazy year that we're all trying to make it through, right? But a lot of people think 2020, perfect vision. That's where LASIK eye surgery comes into play. And it's here to help the blind. So the lasers for LASIK surgery were created back in the 1970s, and it was to help treat myopia, which is nearsightedness, meaning can't see objects far away, but you can see things close up. It wasn't approved by the FDA until 1995, and as of today, it's one of the most common elective surgeries there is, and the most common eye surgery there is. So did you know that 90% of the population wears contacts or glasses? It's a game changer for most of us, LASIK eye surgery. Not just to be able to see without assistance, but to save money in the long run. Glasses and contacts, they're expensive. I think, okay, so this paper right here specifically says an average of $375 per year for contact lenses. So a 25-year-old can expect to spend tens of thousands of dollars on contacts over a lifetime. So that's something to think about. That's a lot of money. For the most part, people don't like pain. LASIK surgery is fairly painless due to the eye drops that they give, numbing drops during and before the surgery. And then they also give like a Valium or a Xanax in order to calm you down during the surgery, so you don't move a lot. Who wouldn't want to see without worrying about losing their glasses or contacts, right? So every time I go to the eye doctor, this is what they do. Here's this, here's this, here's this. Look over this. You'd be a really good candidate for LASIK eye surgery. I've personally done my research over the last couple years, and I've talked to people and I've read reviews. I know a handful of people who've had LASIK surgery and nothing but good reviews. So due to that positive feedback, I'm trying to save money in order to do that for myself, to fix my nearsightedness. So LASIK eye surgery is used to help treat myopia, hyperopia, which I talked about myopia. Hyperopia is farsightedness, meaning you can see far away, but you can't see objects close to you. And then it also helps treat astigmatism. And astigmatism is objects are distorted regardless of if they're far or near. So the surgery is performed by a board-certified ophthalmologist who is also has additional surgical training, and LASIK costs anywhere between $500 and $2,500 per eye. It just, in Louisiana, it just depends on your prescription of your eyes. So it uses the lasers to reshape the cornea in order for light to bend and focus on the retina of the eye. So the surgery happens in the layers of the cornea, leaving the rest of the eye open, available, not touched by the laser. So with nearsightedness or myopia, farsightedness, hyperopia, astigmatism, the vision is blurry due to the cornea bending the light incorrectly to the retina in the back of the eye. So this, like I said, the surgery is typically painless. It lasts about 30 minutes or less. Some experience pressure on the eye or eyelid from the eyelid holder, excuse me. But like I said, they use the drops and everything to help you relax and not feel anything. The laser has a tracker, and the tracker, if you're moving too much or coughing, sneezing, whatever, the tracker and the laser will stop. So it'll turn the laser completely off, and that way it doesn't, do anything wrong to your eye. So when you go to the doctor for an evaluation, he's going to ask you questions. He's going to examine your eyes to see if you're a good candidate. So if you have irregular cornea, certain eye diseases, autoimmune diseases, have persistent dry eye, or take some medications that prevent the healing process from working properly, then you might not be a good candidate. You might not qualify for the surgery. So the doctor's going to look in your eye, and he's going to look for infections, inflammation, high eye pressure, obviously dry eyes beforehand, or large pupils. And this is all during the evaluation. And that's before you get told, hey, you're approved, hey, you're denied. So during the surgery, some people smell an odor. Smells like burning hair. That's normal. Once the surgery's done, your eye may itch, burn, or be watery. Or it might have a grittiness feeling to it. And that's common. That's normal. And your vision should recover quickly. So it usually only takes 2 to 3 months of healing time. So your eye's going to heal itself and your vision's going to stabilize. And during this time, they advise you to not wear makeup. They advise you to hold back on playing sports, getting in the hot tub, all these things that are going to prevent your eye from healing properly. And just like everything else, there are risks with this surgery. So dry eyes after the fact. You could have glares, halos, double vision, undercorrectiveness, overcorrectiveness. They said surgery is required for undercorrectiveness. It's much harder for overcorrection because, they can't really go back and fix an overcorrected eye. Vision loss or change in vision, those two are rare, but they are a risk. It's possible. So it seems that driving at night and headlights are the biggest issue with the reviews that I've seen or heard from people. But that's about it for that. So everybody that I've talked to about their experience with LASIK said they would pay for it all over again in a heartbeat, pay double. It saves the money in the long run. They don't typically have to worry about contacts or glasses. In regards to people who have had this surgery, 8 of 10 of them no longer need glasses or contacts. That's a positive. And so if it's basically painless, it saves you money in the long run and allows me to see permanently without any contacts, I'm invested. I'm ready. Sign me up. All right, that's it. Thanks.